Come again.
Hello, and welcome to the American Massage Conference pre-conference broadcast series on Massage Therapy Radio. I'm Felicia Brown, and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing at the American Massage Conference May 20th through 22nd, 2011. The inaugural event is being sponsored by Massage Today, Massage Envy, Massage Warehouse, and ABMP, and will be held in beautiful Atlanta, Georgia. Our special guest today is David Kent. Dave and I will be talking about his full-day class at the American Massage Conference, headaches, triggers, and treatments. But first, let me tell you a little about David. David Kent is the president and founder of Kent Health Systems that teaches full body dissection seminars to massage therapists and acupuncture physicians at the University of South Florida College of Medicine. David also teaches deep tissue medical massage and practice-building seminars and has developed a line of products including the Postural Analysis Grid Chart, trigger point charts, personalized essential office forms, muscle movement chart, and a series of DVD programs. David has a monthly column in Massage Today called Keeping It Simple that provides treatment and practice-building tips. He is also a regular contributor for Massage Magazine and other leading trade journals on topics from dissection, postural analysis, and trigger points. David, welcome to the American Massage Conference pre-conference broadcast series. As always, it's great to have the chance to talk with you, and especially today to learn about your class, Headaches, Triggers, and Treatments.
Thank you, Felicia. I'm excited to be here and be part of the American Massage Conference and this whole pre-conference broadcast series. I also want to thank all our listeners for taking the time to visit with us today, and especially our sponsors for making it happen. So it's exciting for me to be here.
Well, I can tell, and it's a great topic that you have. Your classes are always really popular, and I know people are going to be really interested to learn more about your background and the class that you're teaching at the American Massage Conference. But first, I just want to ask you, why was it that you wanted to become involved in the American Massage Conference in Atlanta?
Well, I'll tell you, it was a no-brainer for me. It's going to be an outstanding event, and I know that on many levels. I'm excited to be part of it. You know, the American Massage Conference, as you know, is organized by Lorna, Scott, Monica, Robin, and they've been coordinating the Canadian Massage Conference for years now. I was actually just up at the conference presenting and working with the whole team. I was in the Massage Warehouse booth up there, which is one of our sponsors for this show, with Angie Patrick, one of my dear friends. And when they came and spoke to me about the American Massage Conference, I was on board, and especially it's going to be in Atlanta. It's going to be an exciting place, and I'm looking forward to being there.
Well, me too. And with the addition of Angie to the team of people putting this conference together, it's just going to be a rock star event. I know. I think it's going to be a great time. Tell me, David, what events and activities are you most looking forward to? I mean, besides your class, of course. What are you most looking forward to at the American Massage Conference?
Well, you know, I get to hang out with people like you while I'm there. So the entire event's exciting, you know. I get to see a lot of old friends and brainstorm. I get to meet a lot of new people, you know, talk with my colleagues, other people in the industry, see where things are going. There's so much learning and sharing of information and ideas, and then besides the classes, the exhibit hall is phenomenal deals. You know, I do a lot of my major purchasing for my clinic every year at events like this. So this is a smart time for anyone who's considering about purchasing things. You're going to find great deals in the classroom, great deals in the exhibit hall. And if you're looking to have a good time, as you know, this group of people know definitely how to have fun.
You are not kidding. It's a great time, and I just can't wait to be a part of it down in Atlanta. It's going to be an awesome conference, and with educators like you, there's going to be some tremendous education. So, David, in your class description, it has this quote. It says, David Kent teaches this seminar with passion after suffering from debilitating headaches and chronic neck pain for over 20 years and is today pain-free. So I'm curious, David, was your pain what led you to become a massage therapist?
Yes. And I get a little emotional even talking about it here, but yeah, definitely it was headaches, it was pain that brought me into massage, and I believe massage saved my life, definitely has taught me about good quality of life. And what actually got me here was in the early 70s, I started developing headaches, and during the 70s and 80s, I was treated for a lot of different ailments. The headaches, some of the medications from the headaches caused ulcers in the digestive tract, so I was taking medications for that. My jobs were, I guess my life and my jobs, I wasn't processing them in a way, so I had a high blood pressure. Maybe that was partly because of my diet at the same time, lack of exercise. I was having difficulty sleeping. But most of these things, the headaches, the ulcers, the blood pressure, the difficulty sleeping, the aches and pains, were all addressed with pills. And that led to a lot of dysfunction in my body. And over time, I started developing other ailments. I had chronic sinus infections, respiratory infections, inner ear infections that led to dizziness, ringing in the ears, hearing loss, and eventually I was diagnosed with something called Meniere's disease by an ear, nose, and throat. And I was on a lot of medications. Basically, my options were medication, some surgeries were presented to me, and I was also told I needed to learn to live with it. And basically, massage and body work showed me that there was an alternative that I'm very grateful for today. And really, it played a major role, body work and massage did, in relieving my headaches. So, yes, I teach this class with total passion, and I work in my clinic the same way, because when people come in and they think, God, they're sick and tired of having the pain and can it get better? In many cases, not in all cases, but I can tell you in many cases the answer is yes, it can, and massage and body work is a powerful tool for helping people get there.
Well, it sounds like you and I are somewhat similar. It wasn't the same kind of pain that motivated me to become a massage therapist, but like you, I found through alternative treatments and programs that there were options in managing pain besides just taking medication or having surgery where they quote-unquote fixed or took away the part that wasn't working properly, and that's part of my passion for becoming a massage therapist too, is to provide those options for my clients. So, like me, you're still an active practicing therapist.
Yes, I am. Yes, I am.
Yeah. I'm sure your clients are very thankful for that. Is the work that you're teaching at the American Massage Conference part of what helped you to become successful and to stand apart from your competition over the years?
Yeah, definitely. And, like you, I've developed systems. You have systems that you help therapists with your consulting as far as running a streamlined business or spa. And, I've done the same thing where I had to develop systems myself over 20 years ago as a male massage therapist getting into massage, especially in the southern region of Florida that I'm in. I can guarantee you it wasn't received with open arms by these good old boys out here. But over time, I learned to develop systems very quickly, and what I did is I modeled what was working out there. I looked at the other healthcare professions, the medical profession, the chiropractic profession, the physical therapy profession, the acupuncture professions, all professions where I felt like the practitioners were making a real living at. And I thought, God, and I was having trouble getting people to accept me on a serious note, I felt, as a massage therapist, especially a male massage therapist. But when I started modeling certain methods of assessments of how I assessed and took information from my clients, how I started to communicate my objective findings, what I, besides what they told me, what I was actually spotting and identifying, and then how I was laying out a treatment plan to them. So there were 3 different areas, And of course, it's important how you present yourself. I presented myself as a healthcare professional. I know we all do, but sometimes a certain way that we dress or a certain way that we present ourselves can make a huge difference in the consumer's mind. So those were some of the basic things that I did to help set myself apart, and I still do. I still show up, dressed very professionally. Even like the other day, I saw a client, and I've seen this client on and off over the last 20 years. And
wow.
But I still dress as well when that client showed up as I would if a new client was showing up when I walk in that treatment room. And so I think that it's important that we don't let our guard down and that we do stay sharp and that we do keep in mind what the perception is of our clients that we're interacting with.
Well, you're not kidding, and I'll tell you, for anybody that hasn't met David in person, he is always neat as a pin, sharply dressed always, and I know that, that's something I've always noticed about you from the first time I ever saw you, before I even knew who you were. It looks like, not a hair is out of place, the shirt is crisp, and you always do look very professional, and I think you're right. People do take us more seriously as therapists and as healthcare providers when we look the part, as opposed to showing up in a sloppy, half put together outfit, or maybe something we just threw on, or being too casual. And especially when you're talking about pain relief and people are in the mindset of going to a medical practitioner, I think they respect you more and perhaps respect what you're saying more when you're coming from that presentation.
And that's a good point. And I recently, one of our sponsors for this broadcast is Massage Today, and I just wrote an article that I think is being published this month or next month in the issue, and it's talking about it's like entitled "Getting into Our Clients' Heads." And our clients are basically, we've got to keep in mind, our clients have been raised, they're almost brainwashed from birth, that you go to a healthcare provider who, you go and present your symptoms, they listen to you, and then they run some tests. Maybe it's MRIs, CAT scans, or they look in your nose, throat, down, in your ears, and then they draw a conclusion, and then they lay out a treatment plan, medication, rest, a cast, surgery, whatever it may be. So that happens whether they go to their, podiatrist, or they're going to their chiropractor, or they're going to their ear, nose, and throat, or their medical doctor, whatever it may be, or even their physical therapist or occupational therapist. So when we get to a massage therapist, all of a sudden there's this big shift, if that makes sense. They're not getting that, what they kind of like, hold on, all the other healthcare providers have like this whole system, and then they lay out a plan, whether we like it or not. We know that, they're right, and that's what needs to be done, and how are we going to come up with the money to make it happen, right?
Right.
And but massage therapists, we typically don't have that same presentation.
Well, it's true. It's definitely not standardized anyway, and that's certainly not the main topic of your class, but I think it's an important point when you talk about being successful, and I'm going to go off topic here for just a second, but a lot of people will take modality class after modality class, and they'll put all this time into education and then not be successful in their practice, not because of their skill level or lack of skill level, but because of the way they come out and present themselves, the way they market themselves, and really the way they approach their business in terms of a professional nature. And a lot of people don't see this in themselves. They only think, well, I've spent all this money on classes, I have all this talent, why am I not doing well? And I think that is actually a really big part of it, is that their clients don't feel comfortable with them. Either they don't feel they're professional, or maybe they don't take them seriously, or they won't look beyond the exterior to see what talent lies beneath.
Exactly. So I definitely encourage you to get over and read that article when you have a chance at Massage Today. And And really, those are some of the things that help me set myself apart. Some of those same things I integrate into my practice, and some of the same things we're going to talk about in my class. Actually, we will tap on that. It's a hands-on class, but we're going to tap on that as well.
Excellent. Well, David, one of the things I know you talk about often is treating the cause versus treating the symptoms of a pain, of a client's pain, rather. Could you tell me a little bit more about this idea?
Yeah, and thanks for asking. And it's something that we always need to think about. And sometimes therapists, we can almost get locked in and say, well, treating cause and effect, that's what we do in a clinic. I think that whether you're doing an out-call chair massage or table massage, you're going to someone's house or you're setting up a chair in maybe some professional complex where you're doing chair massage at lunch, or you're doing it after work, or you're doing it by health food stores, whatever the events are, I think that you always have the opportunity to educate your clients about cause and effect, and where you come into play, more than just the fact that you're working on them for a little bit and they feel better. That's cool and all, and that might make you a few bucks, but if you're going to, what's going to help you make more of a living is when people consistently understand where you fit into part of their health care, and where they figure on how to budget you in as part of their life plan, because really you do need to be part of that. Just like people service their car and they change the oil and they do certain things, you've got to service your body in a certain way. And they're educated about what happens to their car when they don't change the oil. Well, we've got to educate people a little bit more about what happens where maybe it's not the light on the dashboard. The light is the pain in our head. It's a headache. Why did the pain get there? So the pain is a cause, the headache is a cause, and we want to make sure we're not just treating the symptoms, but we're treating the cause. So when I was treated, primarily what happened is I was being treated for the symptoms. They weren't addressing the cause. As soon as I got on the table of a skilled massage therapist, and they located certain trigger points in certain muscles with me, I was amazed how it recreated the headache pain. So anyway, let me get back to this, cause and effect. No matter what type of practice you're doing, chair massage, out call, working with a chiropractor, in your own situation, or even in a salon, I think it's important when the client comes in with pain that you just take a minute, and it only takes 1 or 2 minutes to look at posture. Actually, in less than 1 minute, I can shoot a front photo and a side photo of a client, and in the second minute, and they can just leave their regular clothes on. They can see a high shoulder or roll forward head posture easily. Even with their clothes on, and they can understand the concept of why the muscles are stressed and how I'm going to help. And I like to show them visuals many times with trigger point charts. So I like them to understand, here's where you hurt, here's why you hurt, and here's how I can help. And I can help you to a degree in this treatment, or I helped you so far in this treatment, but to really accomplish some real goals here, a few more treatments just would make sense, and it's how we present it to them, I believe, how we present the case.
And I'll remind everyone, if you didn't see this when you first tuned into the broadcast, there should be a web link that will take you to David's website and give you some visual idea of what he's talking about in terms of these pictures that you can show to a client in an assessment. He's got a great handout put together, and I'll tell you, when you see his class, or if you've seen him at a trade show or one of these conferences before, you've probably taken a look at this. He's really done a great job of putting a visual representation together for his patients and clients so that they can see exactly what he's talking about and understand why massage is going to help them. It's, we talk about what we feel sometimes in our hands, and that's very hard to explain to a client, but when you can show them that visual representation of what's going on in their body, then they will have a better understanding. And I think, David, you've done a phenomenal job with that, and we've talked about that before, but it's very obvious to me why patients and clients respond to that.
And I had, part of it was just a survival mechanism. When I got into massage, a lot of people didn't want me, they didn't understand why a male was in first a guy. Why does a guy want to touch someone else? And 20 years ago, that was a big issue for a lot of people. Massage has come a long way. But secondly, massage still in many people's mind is not perceived as a therapy. It's perceived as like something you do, like it's foo-foo or something. And massage is very powerful. It's how you present the case and how you communicate. And when you can take a picture and show it to someone, a picture's worth 1,000 words. Whether you're showing them a picture of their own posture or you're showing them a picture of how a trigger point in their upper trapezius refers into their temple or deep behind their eye where they're getting their headache, or how a sternocleidomastoid is referring into their head, and then you're able to show them, look, at the same muscles that have those trigger points also seem to be the same muscles that are stressed as we look at your posture. And that's when you're connecting the dots and turning on the light bulbs for people, and they go, I understand.
Right. Well, tell me about some of the causes of headaches that you will be covering and learning to treat in your class at the American Massage Conference.
Well, it's going to be a phenomenal class. It's a one-day class. That class actually is taking place on Saturday, May 21st, so make sure you sign up. It's going to be an 8-hour class. There's only a few 8-hour classes, so I hope that you're able to join me that day. And what we're going to do throughout the day is I'm just going to show you how simple it is, because really it's not a lot of magic. It's a lot of common sense. You've got the skills in your hands already, I can assure you. It's how you take the skills and how you refine the information to the client. So I'm going to teach you some skills as well. But what we're going to do is we're going to talk about everything and quickly take a look at everything from how you can utilize intake forms quickly to gather information, which can lead you down different ways of determining possibly whether they have low blood sugar or there's, or medications part of the cause here, getting information as to how aggressively you can treat by intakes of, their smoking and their eating habits, things like that. But simple, quick ways of gathering that information. Some important orthopedic assessments that should always be performed before you move forward. We're going to be addressing, and then we're going to also talk about some of the food triggers that can trigger off headaches. But most importantly, we're going to be focusing on the musculoskeletal system, and that's the way posture plays a role with headaches, how trigger points play a role with headaches, how to go about assessing your client fast and quickly, how to educate them and perform treatment on certain muscles. And it's many times people, I think, just get intimidated, or they think they need to be doing something for, a long time to be good at it. I think sometimes it's the order, and it's just getting that information organized a certain way in your head and then implementing it. And after you do it a few times, you'll realize how effective it is.
Well, and you've developed a lot of great tools to help people get organized and to really make it simple. I was really amazed when I first met you. I guess it was at the Canadian Massage Conference, or maybe it was the World Massage Festival, actually, where you were showing me the different charts that you had created and explaining to me, I hope you don't mind me sharing this, but you basically said you did this for your own clarity, because you sometimes had a difficult time like looking at a chart and figuring out what was going on until you have them color coded and really laid out well. Is that correct?
Yeah, basically, I organized it very easily. I organized my entire system by color code by body region. So anything that's blue in my system is head and neck. Anything purple is the spine and thorax region. Green is upper extremity. Red is lower extremity. So whether you pick up a manual for a body region, if it was head and neck, it would be blue. DVDs are blue. The wall charts are blue. Flip charts for that region of the body are blue. And my charts are also different because they're organized by columns. So the head and neck chart, again, if you have a handout, you're able to see one of these later. But you can envision in your head, when I looked at I've owned every trigger point chart that's ever been out there on the market. And they've hung on my treatment room walls over the years. And I've owned every flip chart that's ever been out on the market. My frustration was I couldn't always understand why they grouped or put certain muscles, where they did on the chart, they might be grouped by a region, but no common sense. So I grouped, like the head and neck chart has 4 columns. Column 1, all the muscles on the back of the neck, with the top muscle being the one right under the skin, trapezius, and then as you go down the boxes, the layers of the column, each muscle, you're going deeper into the body. So I designed the charts the way I treat. I figured I don't need to memorize all this stuff all the time. I need to be able to look on the wall and or look in my flip chart and get the information. And I think that's what another big thing, Felicia, is. In my early years, someone would ask me a question, and I was answering their question by showing them a picture in a textbook. And I remember when I was sick and I first went to massage therapists, and they did that for me, I felt like they were looking in the owner's manual. I just didn't feel like it was real professional. I realized they got me the answer. But when someone references a chart on the wall or a flip chart, it just seems like this is some professional tool that's been laid out specifically for this treatment and this purpose. And so I designed the wall charts in a way where I could always get all the answers I needed about all the trigger points that affected headaches in a certain region of the head, or that were grouped in a certain way by region. I grouped them that way, so it would be easy to design and follow treatment plans without keeping information in my head. And that's my goal, keeping it simple.
Well, I think, and based on what I've seen, I think that the systems that you've put together really do make it easy. And I can be honest and say one of the things that in the past has intimidated me about some of those more advanced courses is my lack of ability to remember muscle names. I remembered everything well enough to get through massage school, but some of the deeper muscles that I don't work with all the time, or that are in an area maybe I don't do a type of work that accesses them often, they don't stick with me. It's kind of embarrassing to admit, but I think your charts really make it easy for the therapist to come in and learn this work and not be intimidated by what they don't remember from anatomy class.
That's because you don't need to. All the answers are on the charts, and there's even another second color coding system in there that gives you all the answers. So right in front of your client, you stand there, and all my charts are laminated, the wall charts and flip charts, and I take a wet erase marker and I circle all the answers that I need to perform this treatment or possibilities I need to check or rule out as far as muscle involvement. And I circle it all. The client thinks I'm a rocket scientist, and basically I'm just being very thorough and getting all the information that I need right in front of them, and I'm giving them a quick education. I'm giving myself a quick refresher course, to be honest. And now I don't have to keep in my brain all this information. I can focus 100% on what the client's telling me as I'm treating them, what my hands are feeling as I'm doing the therapy. And when I have a moment to look up and think about where I'm going next, I just look to my wall chart or look to my flip charts or, whatever, my pain scales, whatever I've set up the reference, so that I can keep my head clear for the therapy and not trying to remember, is it the right shoulder or the left shoulder? I mean, how many times have we done that where it's hard to remember which shoulder it is, or low back, is it the right or the left side? They told me when they're standing and now they're supine,
Right.
I mean, we've all had that challenge at some point, I would think, so.
Oh, sure. I'd be embarrassed to admit how many times.
Right.
I sometimes have to imagine. Yeah, I have to imagine when I'm talking to the client after the session okay, where were they? Where was I? Which shoulder would it be if they were laying flat right now? And then I can show them. So
Exactly. So I developed a little form that I make people color in. It's got the body. They just have to color it in, just for a second. Some people are better than others. Some people circle the whole body, but most people will put a bigger, red spot where it hurts. And I hang that on a little stand in my chart or right there in the treatment room that I can keep on referencing, and it doesn't matter whether they're face up or face down or side lying or what. I can instantly just get a visual cue on what I need to make sure I address throughout this treatment session and stay sharp and not confuse this person with the last 3 treatments I've already done today or whatever.
Right. Well, I know, David, as I said, your class is always popular at the Canadian Massage Conference. There were people overflowing out of the room practically. It was so popular, and I know that the same thing is going to be true in Atlanta. What piece of advice do you have for people that are interested in working with pain and headaches, or is there anything else you'd want to share about your class before we finish up?
Well, I hope you can join me. Again, that's Saturday, May 21st. Know that you can go to AmericanMassageConference.com to register, or if you're at my website, there's multiple links throughout, davidkent.com and kenthealth.com, that can direct you back. I believe if you want to learn more about headaches and focus on that, which is a phenomenal area because primarily what I treat is headaches, neck pain, and back pain. Headaches is number 2. I'd say neck pain is number 1. Headaches is number 3, as primarily of what I see in my clinic. But with that said, I think continue to do what you're doing. Listen to broadcasts like this. Come join us at the American Massage Conference. See what type of resources and tools are available for you there in the exhibit hall, and take advantage of the specials that are there. Make sure that you go to my website. I've got plenty of articles geared totally toward headaches, communicating with your patient, different treatments. Also visit, our sponsor sites as well, because they've got a lot of great information. But just continue to do what you're doing. Learn. That's the key. We just want to stay open and learn every day.
Well, I agree with you, David. And tell us your websites one more time, just in case people didn't catch them for the first time, so they can.
You can go to. I think the easiest, davidkent.com will get you there.
davidkent.com. Wonderful.
Right.
Well, I know that people are going to want to come to your class at the American Massage Conference, so I want to share details about that, how to do that, and also remind everybody just exactly what is going on in Atlanta this year. It's going to be an exciting event, and we want you to be a part of the first American Massage Conference. Again, this event's been put together by my friend Scott Dartnell and his wonderful team, Lorna, Monica, Robin, and, of course, Angie Patrick is a new addition to that team, and they are just doing a phenomenal job. They have some amazing people coming to Atlanta in terms of educators and vendors, and $40 is the registration fee to get you access to the event and 25 free one-hour classes. It's an amazing deal to get 25 education classes or 25 one-hour classes for that $40. Plus, you'll also get access to the trade show and opportunity to meet and talk with top massage product manufacturers and vendors. That's also going to enter you in a drawing to win thousands of dollars of door prizes. My gosh, they give away some amazing stuff at these conferences. So the $40 ticket, I think, is really well worth it just for that alone. But in addition to the classes and the trade show and the door prizes, you also get admission to the Saturday night gala that's going to include food, drinks, live entertainment, and a lot of fun. Additionally, you can register for up to 100 hours of continuing education, including David's class with myself and a number of other instructors, and that's all on the website at AmericanMassageConference.com. Now, for students, there's stuff for you here, too. First of all, there's a free student day that includes a Smart from the Start presentation with a number of fabulous presenters and topics that you're going to want to learn about as a student. And there's also a free full-day class with Laura Allen. That class is on how to pass the MBLEX and NCB exams. That is sponsored by ABMP, and the class comes with, for the first 70 people who sign up, a free copy of Laura's book on the same topic, How to Pass Massage and Bodywork Exams, and that's donated by Laura's publisher, Lippincott. At the conference this year, we've also got the first ever National Massage Therapy Job Fair. That's on Sunday the 22nd. You don't have to be an Atlanta or Georgia resident to benefit from this. This is a national job fair, so there will be employers on hand from national, state, and local companies. And by coming to the conference, who knows, you could walk away with a new job. Hotels are really affordable. It's just $121 per night at the conference hotel. You definitely want to stay there if you can, because that's where all the fun will be happening. And you can split that with up to 3 other people to make it even more affordable. So I hope you see what an affordable and educational value this is. I think everybody that can come should be there. As a reminder to everyone, I also want to suggest that you check out the Massage Today Center spread in the May issue. That's going to be our show guide. This show guide is going to go out to over 62,000 massage therapists and will be available free at the show. This is the first nationally circulated conference show guide and has some amazing opportunities for advertising. So if you're a vendor or an educator that's listening in on this series and you want to get some great exposure for your products or classes, please contact Sandy Pierce at Massage Today for details on being a part of the show guide. Of course, the American Massage Conference could not happen without the support of all of our global sponsors, including Massage Envy, Massage Warehouse, ABMP, and, of course, Massage Today. We thank all of them for their support in this year's event. Now, if you'd like to find out how you can attend the American Massage Conference May 20th through 22nd in Atlanta, Georgia, come and meet David and attend his class and other classes with the amazing presenters that will be at this year's event, please visit the official conference website at www.americanmassageconference.com. We also invite you to stay connected with us on Facebook at www.facebook.com/American Massage Conference. After today's discussion and conversation with David Kent, I hope that everyone listening is ready to come to Atlanta and to sign up for David's class, Headache, Triggers, and Treatments. David, thanks as always for taking the time to talk with me and to share your information with everyone. I know that, as always, I learned a lot, and I'm looking forward to seeing you in Atlanta and seeing how your class goes at the American Massage Conference.
Hey, Felicia, I'm looking forward to seeing you there. We were just together down in Miami for the massage school makeover. That was pretty cool, so I'm looking forward to seeing you soon again. It was great talking today. I want to thank you for having me on the program. I want to invite everyone again to visit my website, davidkent.com, or call our office toll-free at 888-574-5600, and we're here to help you. And I look forward to seeing you in Atlanta at the American Massage Conference. Thanks again for having me on, Felicia.
Oh, well, it's my pleasure. Thank you. This is Felicia Brown, and on behalf of everyone from the American Massage Conference and Massage Therapy Radio, I want to thank you for tuning into this broadcast of the American Massage Conference pre-conference broadcast series. Please remember to check back for upcoming interviews each week between now and May 20th. We look forward to seeing you in Atlanta in May. Thanks again for tuning in, and have a fabulous day.
Come again.
Let there be plenty. Let there be plenty love. Let there be